Hello, I'm Charles Blair. I want to give you a couple of tips on the new patient exam. There are basically three new patient exams. Code 0145 is for the child less than 3 years of age. It does include counseling for the parent. So we would use, for that younger kid, less than 3 years of age, we'd use D0145. Now, once we have a child 3 years and up, we actually have two codes for the other two codes. Code 0150 is the comprehensive oral exam, and that would be used for all patients above 3 years and up. This would be a comprehensive exam. We also have code 0180. Code 0180 is the comprehensive periodontal evaluation. Now, in order to use code 180, we have two criteria. First, the patient has to be a perio-type patient. They would have signs and symptoms of perio or risk factors such as diabetes. The code 180 can pay a higher fee, and generally code 180 is available at the higher fee for the initial exam. So what I recommend is going in the computer and setting up a code 0145, code 0150, and code 0180. Again, for 180 we have the requirement that they are a perio patient, plus we must do full mouth probing and charting. One other change that we've had in exams is that the oral cancer exam is now a part of code 120, code 150, code 180. And so that would be the visual exam, what we've learned in dental school: pull out the tongue, do the head and neck exam. And so those are the three exams. So the takeaway here is that code 180 can have a higher UCR. It generally is paid at the front end, up front, with a little higher fee. Remember, though, that is a more in-depth exam. That is a perio patient. Now, concerning checkups, we have two choices of checkup exams. Code 120, and that's the normal recall exam. That does include the oral cancer visual exam. And then we can use code 180 at checkups. Again, the criteria: it must be a perio patient, and we must do full mouth probing and charting. However, at the checkups, many of the insurance plans will downcode code 180 back down to code 120. That doesn't occur at the initial exam, generally speaking, but it can occur at the checkup. So you have two choices at the checkup: code 120 and code 180. We actually have three fluoride codes. D1203 is for the child fluoride, D1204 is for the adult fluoride, and then D1206 is for both children and adults, but it specifically is fluoride varnish, and it is specifically for moderate to high caries risk. Now let me give you little facts about fluoride. Fluoride is typically paid either once a year or twice a year, and fluoride is usually paid up through age 18. So those are generalities. There may be other specifics of various policies. Now, the mistake that I see, and the takeaway here, is many offices, when they convert the child from a child prophy over to the adult prophy, they do not go ahead and convert the fluoride over to the 1204, to the adult fluoride code. They are fearful that's not covered. But you see, 1204 is generally covered. It is adult fluoride, but it's covered up through age 18, or up to age 18 generally. And so 1204 can have a little better reimbursement than 1203. So I would challenge you then, when you do switch over from a child prophy to an adult prophy, go ahead and report it correctly. Report the 1204 code in conjunction with the adult prophy. I want to make a few comments about fraud and fraudulent coding in the dental office. We do see fraud. Fraud means that there is intent, but the problem is you can be nailed just the way in which you are coding without necessarily intent. And so we've seen some cases out here that are very, very disturbing. Let me just cover with you just a couple areas of fraudulent practices that I see. One of the most blatant is when the front business staff date a pan on one date and the bite wings on a different date in order to get better coverage. You see, many insurance companies convert the pan and bite wings, if it's done on the same day, into a full series. The next thing is about discounting. Discounting is legal. If a patient comes in, they're your neighbor, you want to give them a 30% discount, you certainly can. There's absolutely nothing stopping you from giving a 30% discount to your neighbor. However, if your neighbor has a claims form, an insurance claims form, what goes on the claims form? Let's say it's $1,000 of work. The neighbor pays $700. What goes on the claims form, $700 or $1,000? Well, what did the neighbor pay? They paid $700. So the fee was actually $700, not the $1,000, so you need to charge on the claims form $700. It would be fraudulent to misrepresent and say that the patient paid $1,000 when they did not. Fee forgiveness is illegal in every state, the routine fee forgiveness. What we mean by fee forgiveness is the patient comes in and the doctor says, I'll just take the insurance. You cannot do that. When you look at your PPO contracts, if you are a member of a PPO, it will prohibit, most of the time it prohibits any type of fee forgiveness. So reread your contract. Most dentists never read the contract. Also, with the fee forgiveness, can you do it on a limited basis? Yes, from time to time. If you do not participate in a plan, in a given plan, you could do that, but you must let the insurance company know it. How do we do that? We put on the claims form that the patient is not going to participate in the cost of care. So we're telling the insurance, look, this patient is not paying their part. So fee forgiveness should be very, very infrequent. Now here's another one that's just blatant fraud. A doctor offers a special, $49 special. Come in and we'll do the exam on you. We'll do the x-rays on you. It's a $49 special. And then the office bills out the insurance company at the full fees and lets the insurance company pay whatever the full fees are, and then gets nothing from the patient as far as the patient's part. Again, absolute fraud. And so stop these. These are 3 examples of fraudulent practices. We have 2 Pro-Fee codes. We have a child Pro-Fee, which is code 1120, and we have an adult Pro-Fee, which is code 1110. Now the child Pro-Fee is primary dentition and mixed dentition. The adult Pro-Fee is permanent teeth and mixed dentition. So you see, when the kid is in the mixed dentition, legally we can report either a child Pro-Fee or an adult Pro-Fee. However, the insurance industry doesn't see it this way. The insurance industry, for the most part, works on age, and the most common age before the adult Pro-Fee is paid is age 14. Some plans, though, will pay at 12 and 13. A few plans require age 16. So those are the 2 codes for the Pro-Fee. The adult Pro-Fee, again, is code 1110, and the child Pro-Fee is code 1120.